For 6 months, you have to do exclusive breastfeeding. Single drop of mother's milk having more than 200 plus nutrients. Breastfeeding is art and skill. You need to learn.
Mothers with small breast, they doesn't produce enough milk. What is your take on that?
This is a big myth. When mother is doing breastfeeding, she is going to burn calories, nearly 500 kilocalories. Breastfeeding is not only mother and baby journey. This is a family support. Either normal vaginal delivery or C-section. It doesn't matter. Which is for milk secretion. So within half hour, when you start early initiation of breastfeeding, it helps to maintain good amount of milk production.
So, what is this colostrum? What is its importance?
Colostrum we consider as a golden liquid drop, Amrut. Fulfill baby's demand. Baby's stomach capacity is very small initially.
Yeah.
So baby require hardly 5 to 10 ml per second hourly. Cheeks and nose. This is called rooting reflex.
Okay.
If your baby is getting hungry, they will start searching for food, gulping nicely or not, and they can take a rest as well. Because at least minimum 20-25 minutes they need to feed one side nicely.
How will a mother know that baby is getting enough milk?
Because mother is under stress because baby is separated, baby is in NICU, NICU.
During the phase of breastfeeding, if the mother is unwell because of cold, cough, or a severe fever or anything, and she is on medications, can she still continue with breastfeeding? Doctor, if a mother has completely stopped her breastfeeding, can she start it again?
Bring more extra milk, don't discard single drop. With that single drop, with that extra store milk, she can save another baby's life as well.
If you have 1 minute and if you come across any new parent, what would you suggest them? Motherhood is the best thing that can happen to a woman. Imagine it's 3 a.m. in the morning and your baby won't stop crying and your body aches like anything and you are doubting yourself like what wrong I'm doing. So this episode is dedicated to such mothers who have underwent such situations and to all the new mothers. So, welcome to Dr. Yashu Show. Breastfeeding is the least understood topic, and today let's talk about it. My guest today has spent more than a decade in the field of maternal and child health, and she has helped more than 5,000 new mothers in their breastfeeding journey in Rainbow Hospital, Bangalore, and she is also the head in charge of Rainbow Mothers Milk Bank. She is a member of BPNI, that is Breastfeeding Promotion Network of India. She has completed her IBCLC, that is International Board Certified Lactation Consultant. Anagha Kulkarni, welcome to the show. I have been seriously waiting for this conversation from long time.
Thank you so much, Dr. Yashu. We'll try to give more information, evidence-based information to parents so they can learn many good things from this podcast.
Thank you. Doctor, before we begin, what inspired you to take this field?
As a professionally, I completed my medical professional degree in DHMS. Then after that, I was working in Pune in the NICU and is in the pediatric and OBGY team. During that period, I have seen many mothers, they are struggling with breastfeeding. Simultaneously, babies are in NICU, the mothers are under so much stress. That time I felt ki yes, we need to help all these mothers. So I started searching regarding lactation new field. After that, I gave examination IBCLC, which is International Board Certified Lactation examination. And after that, more than I'm happy to tell you, more than 5,000 mothers I help and guided and support many families for their exclusive breastfeeding journey.
Nice, that's really great.
Thank you.
So, without any delay, let's start. Ma'am, can you please tell me that why breast milk is so important? What is so special about breast milk?
So, according to WHO, World Health Organization and UNICEF, you might be know that for 6 months you have to do exclusive breastfeeding. We are suggesting every mother you have to do 6 months exclusive. Why? Because single drop of mother's milk having more than 200 plus nutrients. So it's very necessary for baby. This is the first right for every baby to get mother's milk. That in breast milk you consider you can see more protein, carbohydrate, fat level, water content is also there, stem cells are there. Nowadays, research is going on for HMOs are present in mother's milk, which are fights for cancerous cells. So from that point only, your body is protecting for from babies any kind of infection. First, initially, colostrum is very necessary. We called as a golden liquid drop. You can say as amrut. It is necessary. Why? It benefits for baby as well as mother. Both are having good benefits. This is the first nutrition for your baby. That's why we are giving more importance for breastfeeding.
That's so good. Ma'am, is breastfeeding, is it a natural way or it has to be learned? Is there a technique or we have to learn it?
I must say, breastfeeding is skill and art. You have to learn that technique. Breast milk started naturally. Okay, it starts with second trimester only. So there is no any such thing ki not a single mother don't have single drop of milk at the time of birth. This is a natural process. But breastfeeding is art and skill. You need to learn how to hold baby, how to get baby skin to skin contact,
Okay.
which helps to increase bonding between mama and baby, right? Then how to take proper position to relieve any kind of pain and all these things, because every baby is smart. We are human beings, we are very intelligent. Every baby knows how to suck. When you complete your 32 weeks of pregnancy only, that time only your baby knows, garbha sanskar.
Huh.
All it's happen in our womb only. So baby knows how to suck. Baby knows from where milk will come. Just mother need to learn that technique. Like you're just doing practice. Same way. Breastfeeding is a natural, but you need to learn and you need to train yourself, and then when you are implementing, then automatically breastfeeding journey will be happy and satisfactory.
So it has to be learned.
Yes, mother need to be learned, baby knows how to feed.
Some people tell that mothers with small breast, they doesn't produce enough milk. What is your take on that?
You can consider this is a big myth. First, there are many myths regarding breastfeeding and lactation, regarding mother's diet, then breastfeeding journey. But yes, this is a natural anatomical feature, right? Some mothers are having small breasts, some mothers are having big, large breast. Already milk production started, right? But this is not indication that small breast produce small milk only. How you are feeding frequently for your baby, milk production started. It's always on demand and supply. So it doesn't matter if small breast produce only enough for small amount of milk. Even I have seen there are different kind of patients that they are having different shapes in smaller, so tubular space shape, and but she is on exclusive breastfeeding. So it doesn't matter if small breast produce only little amount of milk. It's like myth. So just she need to do more skin to skin contact, frequently feed your baby, automatically milk production will be there. So there are different phases of milk production as well. Once during that phases, baby is actively sucking on breast, mother can start producing good amount of milk.
Okay.
If you feel my breasts are little saggy or soft because my breasts are small in size, it doesn't mean that you are producing so little amount of milk.
Okay.
This is a physiological indication and it tells you that you are producing good amount of milk. That's why you feel it is soft breast. Okay, so it's like myth ki small breast produce only small quantity of.
So
No need
it's
to
a
worry.
myth and size does not have to do with the
No.
milk production.
Yes.
What would you suggest for mothers to increase milk production?
Many parents they are thinking, or even in Indian culture, there are different variety, right? So in-laws, mother-in-laws, mother, obviously they are worrying and they are providing nutritious food. But still, whenever you are giving nutrition food, it's as a their role as a supplement. They're just supplementing for mama's diet to just maintain her proper diet and calories calculation. Because when mother is doing breastfeeding, she is going to burn calories nearly 500 kilocalories, which is not present with the cardio or aerobics when you're doing in gym also. So mother has to take a balanced proper diet. But yes, there are certain foods we called as a galactagogue in our scientific language, medical term. So which helps to just boost or increase mother's milk production. Means you just consider as a shatavari in Ayurveda. Then the moringa leaves, drumsticks, dill leaves, then methi seeds, sagu, sabudana. It will help to just boost or maintain mother's milk production. But how frequently mother is feeding to her baby? on demand and supply,
Hmm.
which doubles her milk production automatically.
Hmm.
So mama need to be mentally calm down. She need to take proper balanced diet
Okay.
and simultaneously the supplement,
Okay.
which simultaneously both will impact on mother's proper good health, and it will help to improve her milk production automatically.
So this will
Family support.
so family support is also important. So
Yes.
this will helps.
Right.
This helps. Okay.
Because breastfeeding is not only mother and baby journey. Father role is big role,
Okay.
and even in-laws and mother and father also. Means this is a family support. So nowadays there is a new generation in era. Previous it's all changed. Breastfeeding means just mother and baby sitting inside in one room and just she need to do feeding. No, father need to support, changing diaper, cuddling baby, burping baby, give pallida feeds or cup feeding for baby, giving positions or helping position for mama. So father can involve their role during the breast. It's not taking selfie and cuddling, just kissing baby. So different roles will be there. So yes, father can help mama to give proper supplementary diet, which I just explained. Simultaneously, mental and moral support to mama. It can also help to improve milk production suddenly. You just consider is mental relaxation, simultaneously diet. Both will help to improve her mother's health.
This a lot of people needed to know actually. Many people have a doubt that can mother breastfeed after C-section?
Either normal vaginal delivery or C-section. It doesn't matter. Immediately after birth, you need to start feeding for your baby if mother and baby both are in proper medical good condition. If your baby is not having any distress or anything, and mother is also feeling comfortable, either it is a C-section also, yes, immediately on operation theater also you can start doing breastfeeding. This is called breast crawl. In many hospitals we are performing as breast crawl, means baby knows when milk started, and you just need to keep baby on mama's chest. There are different 9 stages. Slowly babies are going towards mama's breast. So you just need to clean baby little bit, and you just put the baby on breast without cutting cord clamp. You just keep the baby on breast. So baby starts sucking automatically on breast. So even where previously I work, even I'm suggesting in many conferences also, breast crawling and golden hour initiation means immediately within half hour or 1 hour breastfeeding makes lot of difference.
Yes.
So it doesn't matter C-section, and you need to keep the baby away from mama, and then after 3-4 hours only you need to start feeding. No, this is also sometimes you can consider as a myth. So immediately after C-section also, even I also had C-section only. I'm having 12 years old daughter. So immediately we started breastfeeding within 1 hour. So no need to worry. Even in C-section, immediately you can start doing breastfeeding.
Okay, either it is C-section or normal delivery. It has nothing to do with breastfeeding.
Yes.
You can immediately start.
Yes.
Doctor, when should breastfeeding start after birth?
So we consider this is as a golden period. Within half hour means 30 minutes after delivery, normal vaginal delivery, and if mama and baby both are fine, then immediately we can start.
Okay.
Even in some hospitals, they are just doing skin to skin contact after delivery without cutting cord as well. They are just keeping the baby on mama's chest and cheeks. So that feeling, that bonding started immediately after birth. And breast crawl also you can do. And even C-section within 1 hour you can start doing breastfeeding. Why it is important? Because this is called golden hour initiation.
Okay.
Skin to skin, which makes the baby more relaxation. Because mother is also waiting for this same period only. So that is a golden point for both of them, right? With the help of skin to skin contact, baby's heart rate get maintained. Baby's hypothermia, that is suddenly some babies are reducing temperature of body, that also get maintained. Then hypoglycemia. Nowadays there are many cases of GDM, gestational diabetes, and hypothyroidism cases are there. So sugar level also get maintained with the baby, because when baby is inside womb, all it's going through placenta to baby. Nutrition is going. So sometimes sugar fluctuation will be there. So with the help of skin to skin contact or golden hour initiation, within half hour when we start breastfeeding, through the colostrum, lactose and another carbohydrates are also going. So it helps to maintain baby sugar level. So once the bonding will start, Once baby start latching on breast, automatically when nipple stimulation started, signal will goes to brain. Now start to produce more milk and secrete more milks. Because there is oxytocin hormone which is called love hormone, which is for milk secretion. So within half hour when you start early initiation of breastfeeding, it helps to maintain good amount of milk production, and that mother who has seen its research proof they're doing exclusive breastfeeding more than 2 years as well. So that's why immediately after birth, or you consider within 1 hour, you have to start breastfeeding.
Okay.
This is a standard method.
Like as soon as the birth is baby is born, within 1 hour, the breastfeeding has to be started.
Yes.
That is
If
the good.
mama and baby both are in normal good condition,
Okay.
there is no any complication, then you have to start.
Okay. So what is this colostrum? What is its importance?
Yeah, colostrum we consider as a golden liquid drop, amrut. Okay, so it's in some mothers it is a transparent watery color, but colostrum normally consider as a golden liquid drop. Mother production started already second trimester, so there are some changes happening through the body. So initially that colostrum come like the sticky thick cheesy as well, you can consider it's a very sticky, very few drops, but in that single drop of mother's milk having more than 200 plus nutrients, which helps to protect your baby from all kind of infection. So having more antibodies, and even you can think in that one single drop or jo colostrum is there, more immunoglobulins are there, more protein levels are also there, which helps to build baby's body structure. Then that colostrum is very thick and heavy, so it can fulfill baby's demand. Baby's stomach capacity is very small initially.
Yeah.
So baby required hardly 5 to 10 ml per second hourly. And mother can produce good amount of milk initially. She is seeing only few drops, but still it's sufficient for her baby. So that colostrum having it having more immunoglobulins, I just mentioned you. Then antibodies are also there. Then carbohydrate, fat content, proteins are there, stem cells are also there. And that colostrum period phase will be from at the time of the birth, means after delivery to till next 3 to 5 days. After that colostrum, mother's milk change into different phase.
Okay.
That is thin milk will start, that is a fore milk and hind milk concept will start. Initially colostrum, it very easily digested. So that's why babies are demanding frequently for feeds. Second thing, that colostrum, it acts as a laxative. Because baby's tummy is very sensitive. After birth, it starts growing up slowly, day by day. It helps to prevent all kind of infection. And specifically NEC, that is a necrotizing enterocolitis, which is sometimes life-threatening infection in preterm babies. So with that single drop of colostrum, when you are giving that to the baby, it helps to protect fast baby's body. So even if baby is in NICU, then we are doing colostrum painting for baby. We are just expressing mother's milk and immediately we are sending that colostrum to NICU as well. NICU. Why? Because it prevents baby's health. It protects your baby. So that's why colostrum is very necessary.
Colostrum is very important, and one drop has like
More than 200 plus nutrients. You
more than
consider-
200
yes.
plus. It's very interesting
Yes,
actually.
and it's first immunization for your baby.
Yes.
After birth, we are giving polio and BCG and hepatitis B. But first immunization, vaccination for your baby is colostrum. That putting one drop, single drop of colostrum, it makes big impact on baby's life.
That's very
To protect your baby.
interesting.
Yes.
A newborn baby is sleepy, and the mother wants to wake it up for feeding. What should she do?
So before telling some tricks how to wake up your baby, yes, definitely I need to tell parents, you need to check why baby is sleepy or sluggish. There are different phases. Means initially first 2 days, if baby is very lethargic and sleepy, might be there is chance of any hypoglycemia or dehydration as well. Okay, so you need to check that. From day 3 to day 7, babies are becoming more sleepy, sometimes because of the jaundice impact also they are becoming more sleepy.
Yes.
And sometimes more weight loss is also there. Sometimes they need more strength to suck on breast, that's why sometimes they are becoming sleepy. But yes, you need to wake up baby, because baby need to be fed every 2 to 3 hourly, because baby's stomach is very small. Slowly it's growing up day by day till after 1 month it will get established.
Okay.
Till as a, you consider as a like one egg. Okay, but before that there are different growth spurts are there daily your baby required. So if your baby is not waking up, so you need to check ki why baby is not waking up after whatever I'm telling you tricks, still baby is not waking up. Yes, definitely you need to take care of your baby, otherwise you need to show to your neonatologist. So this is a baby, sleeping baby. So yes, babies are sleeping a lot. Okay, sometimes baby, if you're not waking up for feeding, baby can one stretch baby will sleep for 6 to 8 hours as well. But baby has to feed every 2 to 3 hourly. There should not be gap between two feeds more than 3 and a half hours. Okay, so if before 2 hour if baby is showing cues, start feeding, no need to worry, but there should not be gap more than 3 hours. So how will you wake up baby? For now baby, this is my baby, baby is sleeping. So you slowly just turn baby here, take the four fingers down. You need to support always baby at the base neck. Then slowly take the baby up. See, this is upright, semi upright position.
Yes.
So baby is in upright position. Okay, my middle finger one ear, thumb another ear, chin I'm just supporting with index in this way. Slowly just bend forward, you support with your chin or chest and slowly pat on baby's back.
Okay.
See, the baby's position, back spine position will be in this way, it should not be bent.
Okay.
Because baby's spine is very delicate. So there are 3 finger gap and again you can take baby up. Okay, so when you are bending you need to do slowly finger walking stimulus on baby's back. So baby will get little alert.
Okay.
Then take baby up. Okay, then make V and just pat on baby's lips, cheeks and nose. This is called rooting reflex.
Okay.
If your baby is getting hungry, they will start searching for food. Babies are very smart. Then second point, here, ear pinna. You need to give stimulation here. Then they will get alert. So this is one point, they will get alert. Then second, you need to check for rooting. Third, this is a finger walking stimulus on baby's back. Then this is a fourth point, you just give the down sole little bit stimulation. Otherwise you can just strike nicely.
Okay.
They will get immediately alert and we will start crying as well. Okay, and still if your baby is not waking up, so this is a red flag sign, you need to take immediately healthcare professional help.
Okay.
Because might be this is indication, might be baby is more lethargic and we need to get attention immediately and you need to go and meet neonatologist. These are the simple way to make the baby alert. Yes, some babies are very smart. They are used to with mother's contact. So normally I'm telling mama, if your baby is not waking up, do all these things. Last will be this plantar stimulation. You just take the baby up and just do skin to skin. Just cheeks to cheeks. Baby start opening mouth and they started licking mama's cheeks. So this is the best way. So she can also feel good. She make more satisfied. Baby also felt, yes, I am with mama. And immediately more milk production started and baby start taking good amount of breastfeeding started immediately. So these are simple tricks how to wake up baby. Because yes, babies are sleeping a lot. You have to wake up baby for feeding.
Doctor, can you please tell us how many times should the baby be fed?
Many mothers they are asking these questions. Yes, baby need to feed every 2 to 3 hourly because this is a standard that after 2 to 3 hour baby will get automatically hungry. Okay, but yes, before baby showing cues or before baby crying, you have to feed baby immediately. Means every baby showing cues before they start crying, you consider as a blinking of eyes, ear to ear movements. They are searching where is my mom and my food, putting hand inside mouth, licking mitten, just doing. They're searching all the time. So there are the early cues, mid cues are there. Crying is always last and late hunger cue. So initially they are searching. Before crying 15 to 20 minutes, every baby is giving some time for mama to get prepare and get ready for breastfeeding. Okay, so you need to observe these cues and you need to start feeding. It's not mandatory ki every 2 hourly I have to feed my baby. Some babies are taking little amount of milk and immediately sleeping and they're getting hungry within half hour as well. So doesn't matter ki you don't need to see clock or any breastfeeding app. You just see your baby. Baby will tell you when I'm getting hungry. So this is called demand feeding. So whenever babies are showing cues, you need to start feeding. But yes, standardly it should not be more than 3 hours gap between two feeds.
Okay, there should not be 3 hours gap between two feeds.
Yes, but before 2 hourly, if your baby starts showing cues, feeding cues, hunger cues, yes, definitely you need to start.
Some people say that mother should feed the baby on for certain minutes on each side. What is your take on that as a lactation consultant?
Initially, mother is having colostrum period.
Hmm.
So it's coming little few drops. Baby's stomach capacity is also very tiny. So that time you giving from both the sides 15 to 20 minutes is acceptable. But once that period is over, means transient milk production started from day 4 or day 6 onwards, then let the baby empty one side nicely. Because mother is having two types of milk. One is a fore milk, one is a hind milk. Fore milk, it is having more water and lactose. Okay, so if you are feeding one side for 15 minutes and immediately you are shifting to another, both the sides your baby is removing water only. Baby is not getting fat content or more nutritious milk as well. So normally as a lactation consultant we are suggesting let the baby take one side nicely, let baby empty one side nicely, and then you can, still your baby is hungry, you feel little cues as well, then offer another breast as well. Don't restrict one side at one time or 10 minutes here 10 minutes another. So this is the baby's choice, let the baby take one side and then you offer another side.
So there's no certain amount of time that baby has to be fed on each side.
Right.
Some mothers cry during their first breastfeed. Like, is the breastfeeding painful?
Yeah. This is very common and natural question.
Uh,
Yes, some mother feels it's painful, but this is also myth. Breastfeeding is not painful. If baby is latching properly on breast, then there will be no any kind of nipple pain for a mama. See what happened during the pregnancy period. There are different hormonal changes are also happening. So it impacts on naturally areola part, breast and nipple. So this is called transient soreness. So it will be first 1 or 2 days or max 3 to 4 days. So once the baby start latching, mother can feel little sensitiveness because this is the first time for her, right? And babies are prone to develop proper suckling activity and they started immediately sucking on nipple. So that's why some mother feel ki I'm starting little soreness and pain. But if you are putting baby in a proper way, there is a deep latch, then no need to worry, their breastfeeding will be not painful. It's like myth ki every time breastfeeding is painful only.
so if proper latching is there, it will not be painful.
Painful.
How does the mother know that the baby is latching correctly?
If mama is having any kind of pain, so definitely it's not good latch, or you can consider as a shallow latch or poor latch. Okay, breastfeeding journey, it has to be happy and satisfactory. There should not be any kind of pain for mother. So good latch means you can consider, always I'm telling to mother that you need to count wet diapers, how many times babies poop, and baby is gaining weight properly or not. Why it is a correlated? If latch is proper, means baby is actively taking good amount of milk. If baby is taking actively good amount of milk, baby will start gaining weight automatically. So both are correlated. So if she, while during the breastfeeding, if she is observing baby's upper lip, lower lip is wide open, baby's chin is touching to breast, there should not be any clicking sound, or baby some makes them sounds, there is a dimple on cheek. So this is indication air is vacuum is creating and air is creating inside mouth, that's why clicking sound is there. So there should not be any clicking sound and baby is actively sucking on breast, and then baby audible swallow, babies are taking gut milk. So this is a good latch. So if mother is not having any kind of breast pain, she's more comfortable, baby is latching properly, this is called deep latch technique, and then baby is passing good amount of urine and poop and baby is gaining weight, so this is good latch. This is indication yes, mother is doing good breastfeeding.
If the mother is not feeling any kind of pain, that it means that latch or feeding is proper.
Proper. Yes.
Doctor, is there any breastfeeding position, like something called this is the best breastfeeding position that the mother can hold the baby up to? Like, is there anything like that?
Best breastfeeding positions in that way you consider as after C-section or normal vaginal delivery, mother which is more comfortable in position. This is best for mama and baby, right? So there are different positions. One is a football hold position, cross cradle hold position, laid back position, or straddle position. Okay, but yes, initially we are not suggesting sideline position because of chances of SIDS. But after delivery, mother is having sometimes little abdomen discomfort, or either it is a normal or C-section. Mother is under little abdominal discomfort. So whichever comfortable for her, you need to go with that position. So I will just show you some basic breastfeeding positions. So mother first need to sit properly. There has to be one back support. She should not be lean or lean forward as well or tilt. Okay. There has to be back support. Then check where is your breast level. Either you can take nowadays you are getting breastfeeding pillows as well, hard horseshoe or firm breastfeeding pillow, or normal pillow also you can use. Whichever comfortable, you can go with that. So first sit nicely and check where is your breast level. Then you can keep one or two pillow so that the level of baby and breast will be parallel. You just keep baby here. Okay, then slowly turn baby towards you. The baby's chest and mama's chest has to be parallel. Okay,
Okay.
you need to take slowly hand from above, and you need to slowly lock the baby ear pumps. Take the forefingers down first. You need to support baby at the base of the neck, so the baby will be in the same level. Baby should not be more down, or baby should not be more up. So you are first supporting here. If you want, you can just take the baby's one hand down here. Then you need to support here baby neck, and you need to support breast. Either you can holding U hold or C hold. When you are starting here holding, and then just do up and down. Once the baby open big mouth, then latch. So this is called cross cradle position. It is more comfortable in normal vaginal delivery mothers because they are able to sit nicely, and they can just stretch their legs nicely. They should not cross their legs first 2 to 3 weeks. So they can feel more comfortable. This is called cross cradle position. Okay. Second thing, once you started this position, cross cradle, once baby started latching properly with the deep latch, you can see audible swallowing, milk transfer is happening. Then if you require, you can just take this hand down here. So elbow and shoulder should be in one line, and you just support here, and then you remove this hand and baby will be here. This is called cradle hold position. So these are basic two are there which is comfortable in normal vaginal delivery. Night time specifically, mothers are more exhausted because full day they are feeding for baby. Sleepless nights also started, so they require little rest that time. And even in a C-section as well, because they are having abdomen discomfort, pain will be there, so they can go with football hold position. Football hold position means just need to keep two pillows here, one pillow here, and another pillow will be down. So again, breast level, baby level will be parallel. Need to keep the baby here, keep the baby, turn the baby. Okay, you adjust baby's hand, then take the hand from above. Slowly, you need to keep first four fingers down. You support here, and then from here, you just hold like the U or C and start feeding. So, baby is with you, and she can take a rest and she can sleep as well. So, this is called football hold, like you're holding football underarms. So, this is a very safe method. Okay, because initially mothers are very afraid to hold baby and handle baby. So babies are with them, skin to skin also will be there. They can see the baby is gulping nicely or not, and they can take a rest as well. Because at least minimum 20 to 25 minutes they need to feed one side nicely, and still sometimes it will get extended for till 35 to 40 minutes, right? So they also feel more comfortable. So this is called football hold position, and previously cross cradle and cradle position. Another is laid back position. So mother can sit nicely, comfortably, and they can go like the recline. And you just keep the baby here and feed here. Okay, this is the laid back position. So these are the basic breastfeeding position. But yes, definitely, mama in which comfort zone, and whichever comfortable for mother, she can go with that position. There is no any specific you have to go with football only or cradle only.
Okay.
So football is new method. Normally I'm preferring initially few days, means first 15-20 days there are babies are actively demanding day night, so mother required rest. So I'm telling them initially you can go with football hold position. Once your tummy and it's all gets settled, then after 5 days or 7 days you can go with cross cradle position, so which is a more comfortable.
So there is no one best position. It depends on the like condition of the mother.
Mother, yes, definitely.
Okay. So doctor, can you tell us about like how will a mother know that baby is getting enough milk?
You need to check how many times baby is passing urine and how many times baby is passing poop as well, and baby is gaining weight or not, because weight and urine are only two indication your breastfeeding going properly and your baby is taking good amount of milk. Initially every baby is reducing weight, and from fifth day onward baby start gaining weight automatically. But if you are doing proper breastfeeding, baby is taking good amount of milk with a deep latch, gulping is also there, and your baby is passing proper good amount of wet diapers you checking and urine, then this is indication yes baby is taking properly milk. You need to see till 2 weeks your baby need to reach back to birth weight. If your baby is not reaching back to birth weight at the time of nearly day of 15 or 18 still, yes you need to either you need to meet lactation consultant or your neonatologist. So within 24 hours one time urine baby need to pass, that is acceptable. Okay, second day started, minimum 2 times baby need to pass urine, and after that baby need to till 6th day baby need to pass minimum 4 times urine within 24 hours, because if feeding is going properly then output will be there, intake is there then output will be there, and then baby will start gaining weight actively from day 5 onwards. Then you check, okay, baby is properly gaining according to growth chart by WHO, then yes, I am doing proper breastfeeding.
So to check the proper breastfeeding, we have to check with whether the baby is passing out urine and motion properly. That has
Yes.
to be checked.
And weight also you need to check.
Weight also. Okay. Few mothers have this sore or cracked nipples. How can it be treated?
Sore nipple or cracked nipples happen because of different reasons. Okay, it doesn't matter only because of poor latch or shallow latch or breastfeeding is not happening properly, uh, and that's why she is having cracked nipples. There are different anatomical features, or you can consider as oral cavity restrictions are there, lip tie or tongue tie is there. Because of that, also mother can feel that she is having little soreness and cracked nipples. Second thing, yes, definitely, if you feel there is a soreness or crackness, first you need to meet your lactation consultant and make sure latching is happening properly or not. If any kind of pain is there for mama, either it is nipple pain, breast pain, or she can get the stinging or tingling pain, this is indication latching need to be improved if there is a shallow latch. Second thing, if there is a typical down cut is there or wound is there, it's recurrent is there, then yes, definitely you need to check baby's oral cavity if there is any restricted movements or tongue tie is there or not. So there are different ways to rule out ki why nipple pain or soreness is there. So this is the indication you need to take proper support and help from lactation consultant.
Sometimes the mother's breast becomes hard and swollen. Why does it happen and how to fix it?
So there are different phases of milk production. Initially, it is a colostrum period. Every mother's milk production started from her, you can consider from 12 to 16 weeks of pregnancy, means second trimester you consider. So already milk production started. Once you put baby on breast after delivery, automatically baby started latching. So this is a natural physiological process. Milk production started. But from day 3 to day 4 onwards, transient milk will start. Transient milk you consider as a fore milk and hind milk. Fore milk it is having more lactose, okay, which is good for brain development, but it's very watery and thin. Initially, when more heaviness is there, automatically more milk production is there. That's why you feel that hardness, heaviness of breast. This is a good indication that mother start feeling heaviness and hardness from day 3, day 4. This is a good indication she started good amount of milk. How frequently she is feeding to baby on demand, it is the best way to relieve engorgement. This is called as engorgement. Okay, there is a physiological engorgement is also there and pathological engorgement is also there. Initially, first 6 to 7 days, mothers feel specifically in early morning because prolactin hormone is there for milk production hormone, okay, which is the highest at the time of midnight. So if any mother miss any night feeding specifically, if or the you can consider there is a gap between two feeds more than 4 or 5 hours, because it's a natural process. Every time milk production will be there, so she can felt as a engorged breast. So there are different methods you can use to reduce engorgement. Some mothers are comfortable with the warm compression. Some others are comfortable to relieve pain with cold compression as well. Then reverse pressure softening technique is also there. And second thing important, which is baby should put on breast. Baby need to suck, remove milk, then automatically engorgement will get reduced. So you just make sure engorgement will be there initially first few days of life after postpartum period, means you consider from the day 3 to day 7, and frequently how you are feeding to your baby, it will get reduced automatically, then engorgement will be not there.
So this swelling or lumps is like it will be caused because of like not feeding the baby properly, and if the feeding is properly done, so this will be resolved. That is
Yes,
the main
yes,
treatment.
latching has to be proper,
Okay.
and baby need to suck and remove good amount of milk,
Mhm.
so there will be no any clogged ups or blocked ups.
If the baby is preterm, does breastfeeding still work?
Yes, definitely. See, preterm babies means you consider which baby is born before 34 weeks of gestation life. Okay. Extreme pre-birth babies are you consider as from the 28 to 30 weeks. Babies are small. Okay. So the requirement is also very small. But yes, every mother start her milk production from her second trimester, 16 week of pregnancy you consider. So it doesn't matter ki if she delivered preterm, milk will be there all the time. But yes, baby's chicks are small, their suckling is little less. Okay, they don't have that much strength to remove actively milk from mother's breast. So yeah, she can do breastfeeding. I have seen many mothers, because my specialization for preterm babies, low birth weight babies, small babies, so I'm giving a proper lactation care plan, how to do hand expression, after KMC also how many times you need to start doing pumping, the pumping schedule, which helps to maintain her milk production. Because maintaining milk production is a first thing, because mother is under stress, because baby is separated, baby is in NICU NICU. So she can start doing hand expression in early days. Then she can start doing pumping simultaneously. She can store her milk. And once baby start gaining weight properly, means you can consider from 1.8 kg baby, then slowly you continue with the pallida feeds supplement you can need to give, because babies are small, they are not able to actively suck. Then you need to consider as a non-nutritive sucking NNS, and simultaneously pallida feeds. And then once the baby start crossing 2 kg 2.5 kg, then proper breastfeeding will start. So yes, it doesn't matter if baby is preterm, mother can do breastfeeding, but we need to give little some time for baby as well as mama.
Hmm.
Patience has to be there. But another way, she can start maintaining her milk production. And once baby start gaining weight, she can nicely doing breastfeeding. I've seen many mothers, preterm babies, they have donated her milk as well as they are doing exclusive breastfeeding till baby cross 1.5 years as well. So it doesn't matter ki premature babies, they don't feel breastfeeding. Either it is a term baby or preterm baby.
Hmm.
Doesn't matter. Breastfeeding will be there, always there.
Some babies will be born with conditions like jaundice. At that time, can mother do breastfeeding to such kind of babies, like or with such conditions?
Why jaundice happen? Because it's a natural physiological phenomenon, right? Even you also got jaundice, me also got jaundice when we were babies,
Hmm.
because it's a liver function started. So that period will be till first you consider 2 to 3 weeks. Okay, jaundice will start showing symptoms from 36 hours of life, or you can consider from the day 2 to day 3. How frequently you are feeding to your baby, it helps to reduce jaundice. So I'm normally insisting all mama frequently feed your baby, because baby has to be hydrated properly. So through urine and potty, jaundice will come down automatically. But jaundice is also having different types. It is a breastfeeding jaundice or another types also, you need to take help and proper guidance and support from neonatologist. Ki if your baby's jaundice is not getting down after 10 days or 15 days, yes, definitely you need to go and meet your pediatrician. Okay, but if she can do feeding, no need to worry. Even to maintain properly hydration for their babies, she can directly feed, as well as if still you feel baby is feeling very sleepy, she can express her milk and through cup feeding she can give. So baby will be fed properly and jaundice will come down automatically. So there is no any restrictions. If baby is having jaundice, mother should not feed.
So there is no restrictions based on the condition of the baby. During the phase of breastfeeding, if the mother is unwell because of cold, cough, or a severe fever or anything, and she's on medications, can she still continue with breastfeeding?
Yes, definitely. Because mother's milk having more antibodies, and if she is having any cough, cold, or any kind of infection, inside her white blood cells are there, they're already producing more antibodies, so babies are getting 2 to 3 times extra antibodies. So she can definitely feed her baby, but yes, definitely she need to take more precautions, hygienic precautions, you can say. She can put mask, wash her hands properly before handling baby, and she can feed properly. But there are certain conditions or any medications, if mother is taking, yes, you need to check with your lactation consultant or gynec team or pediatrician team, she can feed baby or not. But if only cough, cold is there, normal, only viral is there or anything, definitely she can feed baby. No need to worry.
So it depends on the condition, and proper precautions has to be taken before
Yes.
breastfeeding if
Yes.
the mother is unwell. For working mothers, they'll get this maternal leave. After this maternal leave, they has to resume back to their work.
Right.
What about them? Like, should they resume or should they stop breastfeeding once they get into work?
Good question. See, breastfeeding is like overwhelming for if each and every mother. So they are more connected 6 months for their child. Okay, and suddenly they started doing work. Nowadays it's good, might be some mothers are having hybrid like combination for working style, but yes, definitely they need to maintain pumping schedule and continuing with the breastfeeding. And after 6 months, once they started working, they can start giving complementary feed for their baby as well. You need to say she need to do time management as well as work management properly. Am I insisting or suggesting mother how many times you need to do pumping, specifically if baby is 6 to 9 months? Yes, you can continue with the complementary feed with the pumping with breastfeeding 2 to 3 times. Night feeding she need to continue because baby needs mama's touch and that attachment. So during working time she can do pumping 1 or 2 times. Nowadays you can get insulated ice box. So inside in the office, she can just sit quiet place, clean place, she can do pumping, and she can keep that pump milk in bottle, or nowadays you can get the milk storage sterile pouches as well, and put that insulated ice box in refrigerator. While coming, she can again take, do thawing, and that milk she can use to baby as well. So in that way they can maintain work balance and personal life they can maintain.
So you're saying that breastfeeding can be resumed even after um, once you join back to your work also.
Yes, definitely.
What is expressed milk?
Express milk, you can see in different phases. If baby is an NICU, if mother and baby is separated, then she can express her milk, means she can remove either by hand, this is called hand expression, or nowadays you can get different kind of pump as well, either it is a manual pump or electric pump. So when she is expressing milk, she can store that milk as well. So this will be regarding NICU or preterm babies. And again, after during the postpartum period, if she feel ki she is having more milk production, that time also she can express and store that milk. Okay. And third thing, during the working period, means once mother started working, that time also she can express her milk, and she can keep that milk. So there are different ways for the expression milk, either it is a hand expression or you can use by pump, and then you can store and give that milk to your baby.
Doctor, if a mother has completely stopped her breastfeeding, can she start it again?
Yes, this is called relactation. If any kind of situation, if mother is stopping her breastfeeding or there is any gap, you can consider for any for days or for a few weeks or for few months as well, we consider as a relactation. So with the help of more skin to skin contact, if baby is with mama and there is a more physical contact with baby. Second thing, she need to frequently feed baby, means 8 to 12 times in a day on baby's demand she is feeding. Let there is a stimulation to her nipple and for the breast, yes, milk production will get improved. And there are different medications as well as galactagogue diet also there. So with the all these things, with the help of all these things, she can start doing relactation. So yes, definitely, if any mother is willing to start with again breastfeeding, she need to frequently feed her baby, and she can consider as a dream feeding, night feeding, more night feeding, then more skin to skin contact, and with the help of proper diet and medications, she can start doing breastfeeding.
So, up to what age breastfeeding can be done?
Yeah. So first 6 months it is exclusive breastfeeding. Exclusive, you can consider no any another formula or any sugar water or any pre-lacteal feeds, no honey. Means I'm telling at the time of birth, since after delivery till 6 months, only mother's milk is going. This is called exclusive breastfeeding. So first 6 months exclusive breastfeeding. From 6 months till 2 years, you can consider as a complementary feeding with breastfeeding. Consider as a WHO recommended till 2 years, mother can feed her baby. I fed my daughter for 3 years. Okay, so there is no any restrictions. So minimum 6 months you have to feed till it should be